There are many risk factors relating to falls, most of which affect the elderly population. Studies have shown that falls in the older population most often occur with multiple risk factors. There are many risk factors. The main include visual impairment, cognitive impairment, history of falls, and medication use. A decline in visual acuity, depth perception, contrast sensitivity, dark adaptation, and the use of multifocal lenses has shown to put a person at higher risk of falls. Mild to moderate cognitive impairment also increases a person's risk of having a fall. In one study of 1,600 people aged 75 years and above, the risk of having a hip fracture over a 6-year follow-up was twice as high when the score on the mini mental status examination was suggestive of mild impairment compared to those with no impairment. A previous history of falls is a significant risk factor for future falls. Patients who have sustained a hip fracture in the past are also at an increased risk of a second hip fracture. Medication use is one of the most modifiable risk factors for falls. In addition to specific types of medication, greater numbers of medication of any type and recent changes in the dose of medication are associated with increased fall risk. Poor adherence to medications has also been shown to be a risk factor for falls.